Hello. Recently, we had a Hope board meeting, and it was very moving hearing about the desperate needs in Papua New Guinea and Fiji. And so I'd like to show some of what was shared that evening.
First of all, you can see on the slides our Hope Education Program, which is directly supported and funded by Hope Australia, where we work in partnership with a school that's called Mercy Care, which is in a very rough neighborhood. Supports over 100 children there. But one of the challenge was that most of the government, we did not receive our funding to keep our clinics open, and most of the clinics were actually closed last year and this year. A lot of staff were laid off. However, we kept our service going with the support from Hope Global. We also conducted mobile clinic for people living with disability during the lockdown. So during the lockdown, the transport was also on lockdown, so public transport. So no one was able to access the clinic service. So we were able to do mobile clinic where we provide service to people living with disabilities, elderly, even those living with HIV and tuberculosis. We did mobile delivery of drug disbursement and brought the service closer to home. This is a very critical to the catchment population. So even the clinicians feel like it's not right to stay at home while you have like multi-drug resistant TB patients who need TB drugs daily, which they need to come to the facility and get the injection daily. So if we close, where do they go and get that the drug that they need? So that's the dilemma we are in right now. So the need right now is actually, we hope PNG has a contractual agreement with the government where they support our staff's salaries at the facility. But because of COVID last year, the funds have been diverted more into COVID activities for the country. And so to keep the primary healthcare service going was affected last year and this year as well. So the staffs went off salary for about 6 months, but they still came to work and still came to the clinic to serve at the clinic. And so that's our challenge to keep the salaries of our clinicians going.
We really suffered when we closed the airports in March 2020. The impact of that was basically, our tourism industry is about 36% of our GDP. So just imagine 1/3 of your house being taken away. That's the impact of COVID on Fiji. So overnight, over the last 2 years, we've seen $6 billion wiped off our GDP. And for a small country like Fiji, that is catastrophic. So tourism employs over 100,000 Fijians and directly. These are the workers in the hotels and tour operators like ourselves at Rosie's, and about 300,000 indirectly in terms of related services like taxi drivers and shops and so forth. So basically all that has gone, and we are really looking down the barrel of a long-term recession that's compounded by the humanitarian crisis.
We have a lot of hungry people. We have people fighting over food. Food security is a big issue here at the moment. And with the food vouchers that we've been giving out, it's $65 a voucher. So that voucher actually covers a good, a family can at least get some bulk basics from the supermarket to last them for at least a month. So it has helped a lot of families, and a lot of families have been really grateful for these vouchers. So the disciples are quite active going out into the community and looking for families that really need it. Hope gave us 15,000, which I had mentioned to Mark earlier on. I've just exhausted the last, the balance of the 15,000 this week, which I've had to go out and buy vouchers. And because the numbers are increasing, I've just had to stagger it out because of the limited funding that has come through. But we're really grateful for every cent that gets sent through because it's helped so many families.
I just want to say, it's not really a question, but I just want to say that my heart really goes out to you guys, and I see the work that you're doing, and it's awesome. And it's very encouraging to see how hard you're working. And I really appreciate the work that you're doing, and it's easy for us, right? We can just hand over some money, and it's, you know, it doesn't really hurt us that much. And I see you guys and your people suffering. And it does bring tears to my eyes.
The churches in Papua New Guinea and Fiji are extremely grateful for the collection that was made earlier this year. In fact, over $70,000 was raised, and that continues to help our brothers and sisters. The collection that we are making today is going to be supporting the wider community. So that will support primary healthcare, primary education. It will feed hungry families through food aid, and also help with unemployment by providing skills training. So the details of how to give are up on the screen. You can also go to our website, hopewide.org.au. So please be generous. Most importantly, continue to pray for our brothers and sisters, for the communities in these countries. Thank you so much for your support.